session is going to focus on recognizing signs of clinical depression in yourself and others. We're going to talk about what exactly clinical depression is. Keep in mind there are 7 symptoms for clinical depression: major depression, major depressive episode or disorder, depression, or a depressive disorder. And we're going to talk about how clinical depression is different from sadness and blues. And then we'll spend a little bit of time talking about treatment, and we'll spend some time talking about self-care strategies that may help with depression or aid in recovery for those who experience it. To really into what clinical depression is. It is not the same thing as the low mood that really all of us experience from time to time. It really has a deep ability of affect, ability to think about our daily activities. And actually, there is criteria that includes a length of time that you would see these symptoms in order to meet criteria for major depression, and that is 2 weeks. And every day for at least 2 weeks. And symptoms always include both low mood for most of the day and loss of interest in normal activities and relationships. Then there are other additional symptoms that come along with those 2 essential symptoms. And they would include low energy, fatigue, day, feelings of worthlessness, guilt almost every day, difficulty with concentration, and difficulty making decisions, difficulty sleeping, or alternatively, sleeping a lot more than you normally would, almost every day. A markedly diminished interest or pleasure in all activities, almost all activities, nearly every day. And it can be noted by yourself, or it could be by others, by friends, family, and coworkers. And you could feel restless when depressed, or you could feel, alternatively, rather slowed down, like you're moving to describe the feeling. Some people will experience thoughts of death or suicide. It may not be to the suicide, but these images might come into your mind of life, or thinking about death, or perhaps a more passive sense of like, I just wish things were over, or I wish I could just go to sleep, not wake up. And even if you're not thinking of hurting yourself, you might have those thoughts as well. Some people experience change in their weight, more than 5% of their body weight in a month, and that can be either up or down, depending on who you are and how you do. I want to depression is an illness. It's not a sign of weakness any more than having diabetes or high blood pressure or medical illness is a sign of weakness. It's not a sign that somebody doesn't have a strong enough will or has a character flaw. You can't really just snap out of clinical depression. While, as with other illnesses, some people get better without treatment. Typically, people do need treatment to get better. So we know that depression is caused by a combination of factors, and they can include clinical genetic factors. So people with a family history of depression may be more likely to develop depression than people without that family On top of that, environmental stress can certainly trigger depression, particularly financial problems, normal life, but you cause disruption in daily activities, and then some of the depression many months after the loss, then perhaps it's depression that's been triggered by this loss. Relationship or a breakup, separation, or divorce, and change that you can positive can cause that kind of disruption. Problems at work, social isolation or feeling of deprivation, and physical, sexual, or emotional trauma can contribute to someone developing depression. Another thing that can lead to depression or can actually cause depressive is other serious illnesses such as heart disease or Parkinson's. Depression can make those conditions worse, and those conditions can so being treated for a major, serious medical illness. Mood is something that they should be talking to their healthcare about. Sometimes medication taken for illnesses may cause that can trigger or worsen depression. So it's another reason why it's important to talk to your medical doctor about mood, energy, and all of those other things we mentioned that symptoms of depression. So that depression is a very common disorder. Estimates are between 20 and 25% of adults may suffer an episode of clinical depression at some point during their lifetime. Let's note that clinical depression also affects older teens and children, but frequently goes undiagnosed in these populations, which is why we're talking about what depression can look like in those specific populations as well. So twice as many women as men experience depression. And there's often hormonal changes that occur during puberty, pregnancy, miscarriage may increase the risk. Women are biologically vulnerable to depression due to those hormonal changes, also due to genetics. For them, increased stress and overwork will also increase the risk. For men, can look different than it does for women. It's quite common in men, but probably undertreated, underdiagnosed in men. May look different than it does. So, rapidly expressing sadness, men with depression may seem angry, irritable, and aggressive. They may feel restless and edged. They may feel flat and interest in work, family, sex, and hobbies. They may engage in high-risk or escapist activities. So, for example, if we're working all the time, it could be one way to those depressive feelings. And self-medicate with alcohol and drugs. They may be more likely than women with depression to have trouble, and they may seek for physical, in fact, rooted in mental disorders, such as chest tightness and digestive problems. So they may go to their doctor, and their doctor may take note of the symptoms, some tests, and not really find an organic biological cause for the problems, and then the health diagnosis for those symptoms. Clinical depression may experience some of the same symptoms you mentioned as men and women experiencing, but are more likely irritability, restlessness, sadness, and mood swings. Plenty of adults have difficulty expressing their emotions and describing their emotions and identifying their emotions. And of course, children may have even more difficulty than adults have had the experience that adults have had doing that. So their way of feeling these emotions is more likely to involve acting out in some kind of way. They may have difficulty sleeping or concentrating. You may observe failing grades, or just flat out not wanting to go. And you may notice a change in eating habits. You may notice that they're feeling listless, withdrawing from friends' activities, appearing to have lower energy, complaining of lower energy, and expressing low self-esteem. Children do, as adults do, sometimes have thoughts of suicide when they're experiencing depression. The depression is also common among older adults, but it's important to note that developing depression is not normal or inevitable. But it's true life changes and losses may increase uneasy stress, sadness, and sadness may actually not be the most obvious symptom of depression in older people. They may complain of fatigue, they may experience insomnia, irritability, confusion, or so depression is quite severe. Sometimes there's these other brain conditions. So cause, and again, some medications may have side effects that contribute to depression. So how is depression diagnosed? A health or mental health professional will perform a thorough assessment, and they're going to be asking questions of what broad sweep of a person's life to get a sense of what's going on that may contribute to some of these feelings, how long these feelings have been experienced, and what exactly they are. And the diagnostic clinician may be a primary care doctor, practitioner, clinical worker, a licensed professional counselor, or a licensed clinical psychologist. And again, before giving a diagnosis of depression, your doctor may rule out other problems with similar to those of depression. So often, if you visit to a primary care doctor, especially if this is somebody who knows you well, who you've been seeing for a long time, it's a really great place to start if you want to be depressed. So an internal medicine doctor, an OBGYN, or a family practitioner is a great place to start for many folks. If they're wondering about depression. There are several ways to treat clinical depression, often a combination approach is helpful. So one is medication. A primary care doctor, psychiatrist, psychiatric practitioner you'll try different medications and doses to determine which medicine works best for you. So often there's some patience involved in figuring out which medications work best. Generally, providers will see patients that are fairly low dose and take it up gradually, what's effective, and then switch or combine medications depending on the symptoms, depending on some of the effects that you might experience from some of these medications. For some people with a strong biological component, depression is going to be the single most effective form of treatment for that depression. And also can kind of act as like the paddles you use to get upriver, and the work you do is in therapy, in psychotherapy. And the medication can make it possible to do the work with like psychotherapy that is going to produce some lasting positive effects on symptoms. So psychotherapy can be provided by a psychiatrist, a clinical licensed marriage and family therapist, a licensed social worker, or a licensed certified professional counselor. The therapist is going to partner with you to explore your emotions, to find new ways to think, feel, and act. And it can be very highly effective. There are several different types of approaches to therapy. There's the behavioral focus less on the past, more on what to do with the current having, and then dynamic therapy, which focuses more on sort of the root causes or the childhood experience or the patterns of long-held patterns of behavior that might be emerging. In rare cases, very rare, but somewhat rare cases, there's both electric convulsive therapy and magnetic. Some psychiatrists will use for severe depressive episodes that do not respond to antidepressants when rapid relief is needed. So for some folks, that is a form of therapy. It is therapy, though. It comes down to it, if and when other forms have not been effective or sufficiently. So let's move on to talk about self-care and strategies that help prevent depression, lessen its impact, and promote healing. So for those who experienced clinical depression in the past, it's important to know that you're at elevated risk for having another episode. So story may be helpful really understand what triggers have been in the past for depressive episodes for you, and what kinds of symptoms you typically experience when you are in a major depressive episode. And so symptoms or note that those triggers are present, it's good to talk with your doctor. Also, it's to keep in mind to discontinue therapy with antidepressant medication if you're feeling better before consulting your doctor. So you sometimes have the medicine works, and that's why you feel better, and so you make that decision by yourself. You're less motivated to take that medication every day, so stop. Sometimes happens is the depression comes back. And so it's best to consult with your doctor so that you can mindfully that perhaps ramp up your appointments with your doctor so that your doctor can kind of keep an eye on how you're responding to that reduction and or discontinuation of medication to see whether the changes that have been put in place by the medicine and perhaps also by psychotherapy are going to be as you move forward, whether you need to continue on the medication for some time longer. And then resilience, it's great to learn methods to practice good self-care. So for everyone, know the triggers and symptoms of clinical depression, know your for developing depression, and to resilience, practice good self-care. So let's talk about some ways to enhance and bolster your resilience. So the first five-part model is thinking about how to best manage your physical and really this is about taking care of your body and taking care, particularly of the routines that your body is used to. We do routine. So part of that is practicing really good sleep hygiene. So having a regular time to get up. I know a lot of phones now have a bedtime feature that reminds you when to go to bed and when to get up. So no longer setting your alarm in the morning to have the time for wherever you're going to, but it's actually a routine for going to bed, a routine for lights out, and a routine for getting up in the morning that's consistent. Even on weekends is wise, especially if you're vulnerable to depression. It's wise to go to bed and get up at pretty much the same time on those days. And there are other good ways. Hygiene, limiting screen time before bed, trying to work through some of the conflicts you've experienced during the day, either through exercise or by talking it out with a spouse or a family member or a friend before you go to bed, before you even attempt to go to sleep is a good idea. And all kinds of other great good hygiene practices that you can make. Keeping your bedroom only for sleeping and sex is a good idea as well. And so sleep, very, very important to maintaining that good mental health. Eating healthy foods is important as well. Feeding the body in a way that bolsters immunity and strength is important. Establishing a regular exercise routine is wonderful also, whether that's just a walk around the block, especially if you can that with walking a pet or talking to a loved one. It's a wonderful thing to do and really can promote and the ability to fall asleep better and feel better. And then just the effects of medications, alcohol, and other physical well-being, including the quality of your sleep. So it isn't heard of for people with alcohol to help them fall asleep. And sometimes it does help people fall asleep. It makes a complete mess protector of sleep, and it will wake you up in the middle of the night. You will not back to sleep. So alcohol is not a good medication to use to help with sleep. And then finally, engage in creative and joy-inspiring activities, whether that's sports league, dancing, an art class, or coloring books, anything like that that gets your mind out of your brain and gets it into your body as well. will help you feel better. The second part of the 5-part resilience model is to bring perspective to your thoughts. So practicing gratitude is not always easy, especially if we're in a low. But looking for opportunities to be grateful is shown to be helpful. It doesn't mean that we don't honestly face information. We need to do that as well. But we need to step back and out of our thoughts as much as we can to say, how reasonable is this thought? If you find yourself thinking the word should or shouldn't a lot, or the word always or never a lot, that can be an indication that your thoughts are not really reality-based, being affected by depressive symptoms, actually turn into depressive symptoms, because it's like you're feeding the negative thoughts with additional negative thoughts. Focus on changing within power to control. So it can be helpful to even sketch this out on a piece of paper and draw a circle in the middle of the paper, and within that circle, these things are within my control. And then outside the circle, write things that are not at this time within your control. And focus on making changes that are to make, and that will feel better through your life, feeling stronger. Focusing on seeking solutions rather than becoming mired in the problem. So if you find yourself reviewing the problem again and again, at some point step back and say, okay, I've clarified what the problem is, so let's move on to the next step. Is there a solution? If there is one right now, but is there a way to take thought, just the problem, to the solution? And by the way, a psychotherapist can be very, very helpful in coaching you through these new ways of thinking. The third five-part resilience model is practice emotional intelligence. So acknowledging and expressing emotions with as specificity as you can. So I feel bad, I feel sad, I feel angry, I feel worried, I feel fearful, I feel confused. All of these emotions are to sort of label. The actual act of labeling the emotions can give us a little bit of space between our mind and our allow us a little bit more control. The other thing that can be super helpful is empathize and provide support to others. And so one of the things that can happen with depression is if we allow it to, and especially after we've started to move out, create a greater ability for us to empathize with other people's pain. And so there is a role in providing empathy and support to others that can be very helpful, even on a neurochemical level. And so that oxytocin, which is a very comforting, is released when we empathize with another person. It really can help us sort of get out of the loop of depressive thinking that we have in our minds. So we have a question about how social media affects mental health. Does it contribute to a negative effect? Also, there's a fantastic app called Shine that I have found very helpful overall and mental health. That is wonderful. Thank you so much for bringing up the topic and mentioning Shine. Yes, social media is problematic. The experience can be, my life isn't as the other lives I'm seeing curated in the social media site, and that can have a really negative effect. We can very easily forget that other people are choosing to put on social media. Also, we can view a lot of negative information on social media. A lot of us have on social media either getting from a dopamine release when we see something, let's say, that we agree with politically, it makes us feel great in the moment, but that doesn't last, and we end up for that dopamine release by spending more time on social media. It takes away from the other things that can be helpful, like engaging in creative activities and social relationships, face-to-face social relationships or phone social relationships that can be helpful. So I think it's really great to be mindful of one's use of social media, to note the effect that 10 minutes on social media has on our minds and on our thinking, and to think about ways to limit our use if it's having a negative effect. Maybe decide we're not going to news feed anymore. There are some people or certain organizations we're no longer going to follow, and that can be helpful. For some people, the best approach is to just stop, because it really can have that negative. In addition to Shine, there's quite a few wonderful apps that can help teach mindfulness, which we'll talk about a little bit later presentation. My skills are really about, and we've alluded to this already, being able to step back from one's thoughts and experience thoughts, feelings that do not dive in into them, but let them kind of flow through your consciousness and your awareness. And there are many apps that can help training on that. There's the Calm app. There's also Insight Meditation Timer. There's a really wonderful one that's just sitting in my mind right now. Headspace is another excellent app for that. So thanks for that question. That hard work of acknowledging emotions. Some of us were blessed childhoods in which we were helped through that process and taught to acknowledge emotions, but many first grade to learn about how to acknowledge emotions, and there's no shame in that. It can be very helpful. Is the acronym's name. So the N is for notice the emotion. So, emotions reveal themselves in physical sensations. So a knot in the pit of your stomach, tight shoulders. You may notice that your brow is furrowed, your back teeth are clenched. So those physical signals can remind us that those emotions are lurking there. And so then we ask the question, what's going on? Now, and then the A is to, as I referenced before, you can get without acknowledgement, the better. There are posters, there are visuals available on the internet that kind of help us run through the emotions and be as specific as possible in making the emotion. And then the end is to make space for the emotion. So open up your awareness and kind of allow it to be. So you're not pushing it down, you're not pushing it away, you are allowing that emotion to space, which actually allow it the space and it's ready to dissipate and to move on. And the key is to expand awareness, to kind of have a sense that this emotion is here with me now. It was not here with me a half hour ago. It will be going, and another emotion will arise, and you kind of allow those emotions to flow through. So the it's not about feeling better, but rather allowing yourself to experience whatever arises without criticizing or judging yourself or also refer to the power of empathy. So to calm empathize with others by learning and practicing skills, by pressing pause on giving advice and judging. In other words, you don't want to dive toward a solution for your friends. You want to be fully to them with depth and intimacy. Build with others and know that connections can protect you. Whether you're an extrovert or connection. So being able to form strength, it can really right your strengths. What is that you bring to the table that will be left. First, and for another present spaces, but to look around the different spaces for you and create that diverse and robust network. How you express feelings, whether that's conversations with a partner, friend, colleague, journal, which exists both on art, painting, drawing, coloring books, a big work back, and then physical, like walking or gentle yoga or dance. Those so for those of you most the health system, you are eligible for FASAP's help, and for those of you who aren't, specific support and all children's, you also have an EAP that you could by department. So what EAPs do is they step in and provide assessment and breathe. Referrals, if necessary, to treatment providers. So meeting clinician fast, your own EAP can help whether in fact um, can you explore those EAPs are free and confidential. Asset services are offered to staff. Um, um, and that conflict mental health resources well, that circulation that well. You want to help people but it's depression. You for Washington, located in Columbia, and really good organization. To it's maybe flat on. So that you feel your feet on the floor, you feel your legs and the backs of your hands resting gently on your legs. And just take a long breath, if you can, through the nose, way deep down into your belly. And when you're ready to exhale, let that exhale soft. And notice the little space you inhale, you exhale. Just take a few more breaths that way, focusing on making the exhale a bit longer than the inhale. Now, you need to attend to your breath, but never try to change your breath from what it just naturally wants to be, and let it be as long or short as it wants to be, let it be as shallow or deep as it wants to be. But just pay attention to your breath. Let your attention drop down into the rise and fall. Very good. All right, so Liz, I think it's time for some questions, if anybody has any. And I would say if you have a question about your own health, and you're not, and you're not sharing yourself in this venue, if you're eligible, I would encourage you to give us a call. You can set up an appointment with clinicians, or if you're feeling really bad today, you can call a clinician to give you a call and have a conversation. If not part of the FASAP group, you can certainly call your own PAP, but I'm very happy to answer or try to answer all questions that you have.
So I would encourage anyone to utilize the feature here. We'll be unmuting all participants. If you have any general questions, do that. Just mindful of background noise in your area. If there's a lot of feedback, we will unfortunately have to return to everyone being muted here. So we will go ahead and unmute everyone. If you have a question, we have